Greetings, this is Dr. John Tamilio III, your medical ethics professor. We're living in a strange time, speaking of medicine and medical ethics, COVID-19 and all this remote learning. It's a new thing for some of you, I'm sure. I hope the class is going well. I've been posting lecture notes online. Along with discussion questions, and I hope you're keeping up with that. And of course, the reading from the textbook, the Bioethics, the fourth edition, I believe. This happens to be the third one, but I think we're on the fourth one now, by Lewis Vaughn. We're on the third chapter now, so we've finished the theory part of the course, right? Where we've looked at ethical theory in depth. We've looked at Aristotle and his virtue ethics, also known as eudaimonia. We looked at Immanuel Kant's categorical imperative. Utilitarianism is put forth by Jeremy Bentham and his student, John Stuart Mill. We talked about prima facie duties. That was put forth by the British philosopher W.D. Ross. We've also talked a little bit about religious ethics, particularly the divine command theory, which really, for all intents and purposes, in this Western philosophical context, one of the earliest expressions of the divine command theory can be found in Plato's dialogue Euthyphro, which we've talked about as well. And then, of course, cultural or ethical relativism. So we've covered that. We've laid the foundation. Now we're going to delve into the course content. And this week we're talking about paternalism and patient autonomy. If you read the chapter, it's pretty self-explanatory. So I just want to go over as a lecture a couple things that I want to lift up and have you be thinking about as you explore this topic further. At the end of the chapter, Vaughn says there are a few key terms here. And understanding those terms, I think, will really help you understand the whole concept. The terms he lists are autonomy, medical futility, paternalism, strong paternalism, weak paternalism. Autonomy, the term autonomy really means self-governing, okay? You are an autonomous person. You're self-governing. You're self-determining. You can decide what you want to do with your life. You can decide where you want to go to school, where you want to work, all of those things. No one has a right to really subvert or override that autonomy. I mean, part of what we prize most about living in a free country is that we're free to do what we want. We have liberty, right? Obviously with restrictions. You can't do just anything you want, but we are autonomous, self-governing individuals. And that's true when it comes to healthcare choices, right? If you go to the doctor and you're diagnosed with an illness and the doctor proposes a course of treatment, you don't have to follow that course of treatment. You can ignore the doctor's advice, and maybe you want to ignore it because you don't want to face the truth, or maybe you disagree on religious grounds, or maybe you want a second opinion, or whatever it is. You have that right because you're an autonomous individual. Paternalism occurs when a doctor, in the case of medical ethics, it occurs when a doctor overrides a patient's autonomy. Weak paternalism occurs when a patient's autonomy has already been compromised. Strong paternalism is when it hasn't been compromised. What do we mean by that? Well, if you're in an accident and you're rushed to the hospital and you can't communicate, doctors are going to do whatever is within their power to help you, to assist you, to save your life. You may have advanced directives, meaning you may have a living will, or you may have otherwise stated what you want done in the case of an emergency. In other words, do you want to be kept alive with a feeding tube, it's also called the nasogastric feeding tube, or do you want a breathing tube, which is a type of respirator to help you breathe? Right? Some people don't want that. They don't want artificial devices. Well, if you haven't indicated those things in a living will or a healthcare proxy, which is a person who knows what your wishes are, then doctors are going to do whatever is reasonable and within their power to help you, okay? If you're unconscious and doctors are performing whatever procedure on you, that is a sort of paternalism, right? It's called weak paternalism because they're not really going against your wishes so much, they don't know what your wishes are. Strong paternalism would occur if a doctor overrides your decision and you made that decision of your own free will, a conscious, well thought out decision. Doctor disagrees with it and overrides that. That really doesn't happen much anymore. It used to be the norm. It used to be accepted that the doctors would do what they thought was right. It's not really nowadays in medical ethics. We shun that. We say doctors, shouldn't do those types of things. They shouldn't override a person's own decision. Now, there are cases where that call this into question. For example, children aren't considered autonomous because they're under the care of their parents. So parents decide a lot of things for their kids, right? All kinds of things. Whether you tell them they have to eat their vegetables or go to bed early or get off their cell phone or go to school, whatever it is you tell your kids to do, that you're exerting a level of paternalism. That word paternalism sounds like the word parent, has the same root to it, because you're parenting, you're overriding what your child may want to do because you're doing it in his or her best interests, right? You're doing that for the good of the child. Well, there are other people who are subject to the paternalism of others. Some people end up being institutionalized because of cognitive problems or emotional problems they have. And they don't always wish to be institutionalized, right? Sometimes it's against their will. Well, when that happens, that's a type of paternalism, where someone has exercised their judgment and overridden what the other person wants, okay? Well, back to what I was saying about cases that come up in medical ethics. The discussion question for this week actually deals with this, and it talks about if parents, and there have been a number of cases on this issue, where parents have a child, say a young child that's sick, and they don't seek medical attention because medical practice goes against their religious beliefs. There are certain religions who don't look favorably upon medicine or think certain things are the will of God, so medicine shouldn't be used to intervene in that. Jehovah's Witnesses, for example, don't believe in blood transfusions. It goes against their religious beliefs. Christian scientists place a great deal of emphasis on the power of prayer and spiritual healing as opposed to medicine. If those are your beliefs, that's great, that's fine. But the problem becomes if you have a child that's suffering from a sickness and they need medical attention, but you choose not to seek medical attention because it goes against your religious beliefs. Is that moral? Is that ethical? There are certain dilemmas that come up where paternalism and autonomy come into conflict with one another. And parsing that out isn't always easy. It's not always clear cut. Later on in the class, we're going to talk about truth-telling, and that relates to this issue. Is it ever okay for doctors to lie to their patients because they're afraid how that patient will respond when they hear, of a dire, prognosis, or, for example, for a disease? Anyway, these are terms to keep in mind: autonomy, paternalism, and then with paternalism, weak paternalism and strong paternalism. I strongly encourage you, no pun intended, to read the chapter carefully and to maybe do some additional research on these terms to make sure you understand what they mean and what they don't mean. Medical futility, one of the terms that's used in this chapter, is when a medical procedure isn't going to do the patient any good. It's not going to really help them, okay? Doctors should not perform medical procedures on patients that are not going to be of any benefit to them, okay? Now, I've had students in the past talk about plastic surgery or cosmetic surgery in this regard, saying, people don't really need to have it done typically. Is it ethical? That gets to be a tricky question, and that's not really what is being discussed in this chapter. I mean, if having a nose job or a chin tuck or something like that makes someone feel better about themselves, all the power to you, I guess. But that's not really a life or death issue, and this chapter is really dealing with that more than anything else. So in other words, if someone's dying of cancer, say someone has stage 4 cancer and they're very, very sick and they're dying and their prognosis isn't great, and then it's discovered in the course of treatment that the person needs a heart transplant, right? Well, they're probably not going to get the heart transplant because the transplant itself could potentially kill them because of their weakened state. But also, it's not really going to prolong their life that much longer, right? So that would fall under the umbrella of medical futility. It's not necessary. It's futile treatment, so to speak. With all due respect to people suffering from cancer or who need heart transplants, there's certain procedures, depending on the situation, that don't prove helpful. There's a classic case about a man who took the Bible literally, where it says in the New Testament, where Jesus says, if your right hand offends you, cut it off. It's better for you to go to heaven, to enter the kingdom of God with one hand than have both hands and go to hell. There's a classic case about a man who sinned using his hand and wanted to remove it because he took that passage literally and went to the doctor asking the doctor to amputate his hand. Well, the doctor, thought that to be medically futile. It wasn't necessary, even though that was the man's religious belief, which he's entitled to. It's not the doctor's job to amputate a perfectly good hand because the person feels as if, he sinned with it or something like that. So medical futility sort of runs the gamut in that regard. Again, one of the things that it says here in the summary to the chapter, patient autonomy and physician or nurse beneficence often come in conflict, when patients refuse treatment. That term, beneficence, a doctor has a duty, and that is to treat their patients, to heal, to care for them, not to do them harm. It would behoove you to read in this chapter. There is a copy of the Hippocratic Oath, and if you don't have the textbook for whatever reason, you might want to look this up. The Hippocratic Oath is an oath that physicians take when they become doctors. When they're sort of sworn in to be a physician. And, the classical Hippocratic Oath dates to about, the 5th century BCE, or BC, whichever term you use. And it's attributed to the ancient Greeks, to Hippocrates. And so some of the language here is somewhat dated, but a lot of what is promised in the oath is still in practice today. It's still believed, right? This whole keeping confidences, for example, right? A doctor-patient confidentiality is sort of encoded in the Hippocratic Oath. To do no harm to patients is part of the Hippocratic Oath. The Hippocratic Oath also talks about abortion and euthanasia in ways that will be, when we talk about those topics, it's going to be interesting, because it says in here specifically that doctors will not give to a woman an abortive remedy. And it's also stated in here that, doctors will not assist in ending people's lives. So, I'm not saying, therefore, abortion's wrong or euthanasia's wrong from a moral perspective. All I'm saying is that the Hippocratic Oath certainly poses a challenge to that, right? And so we're going to be thinking about that when we cover that part of the course. But I suggest that you read it in the third edition, which I have here. I think I left my copy of the fourth edition in my office. It's in this edition, it's on page 83. So whichever edition of the text you have, it should be around that page number. I recommend reading the Hippocratic Oath. And there are other variations on the Hippocratic Oath, sort of more modern takes on it. Take a look at them, read them. Patients have a right to refuse treatment. They do. They have a right to refuse treatment. And doctors have an oath to heal patients and to exercise beneficence, meaning you're thinking of the well-being of your patient. Well, those things can come in conflict, right? I can refuse treatment that I really should have. The doctor's trying to heal me, has taken an oath, promotes beneficence. It's kind of like this. I always tell my students that there are certain types of cancer, when you catch them early enough, are very treatable, right? Breast cancer, if it's caught early on, very treatable. Testicular cancer, if it's caught early on, very treatable. So I would highly recommend that if you found you had early stages of breast cancer or testicular cancer, you listen to your doctor, right? And you do what you need to do to get treatment. Because if you leave it untreated, it can become very serious. It can advance and obviously can eventually kill you. Well, you have a right, if you have, say, stage 1 breast cancer, to refuse treatment. I'm not sure why you would, but you have that right to. Should the doctor try to override that, knowing it's in your best interest? In other words, should the doctor exercise paternalism when he or she feels that your autonomy is putting you at risk? Parents do it all the time. They override what their children want to do when they feel as if their actions are putting them at risk. However, as autonomous adults, we look at things differently, and we think that one of the values that we espouse is freedom and freedom of choice and autonomy. So it suffice it to say, it's a complicated issue. So what I recommend you do at this point for this chapter, make sure you understand, autonomy and what that really means. Because there are times people's autonomy is overridden because they're not autonomous. Autonomous means that you're of sound mind and judgment, right? So if you're not autonomous because you're impaired in some way, maybe you have a mental disorder, right, a cognitive disorder, or maybe you're drunk, right, or you're high, and so what you're doing isn't necessarily what a rational person would do, and so your actions might be overridden by authority figures, okay, authorities in society. So kind of really look into that autonomy and what we mean by that. Look into the term paternalism, weak paternalism, strong paternalism, patients' rights to refuse treatment. Be looking into the Hippocratic Oath. Look into futile treatment, what that really means. Be thinking of advanced directives. Advanced directives have to do with, if you are a relatively, say, healthy person, and you know certain things about yourself, certain treatments you would not want to receive. Some people put together what's called a living will. I mentioned that earlier. A living will just spells out what your wishes are in the event that you are not autonomous, okay? Some people have a healthcare proxy, a person who knows their wishes, who can speak on their behalf. Sometimes people have what's called a DNR, which is a do not resuscitate order. This is pretty common with people who are very old, who might be in the hospital for something or a nursing home. They might have there's often a red band that they'll wear around their wrist, and sometimes it says DNR on the band. It do not resuscitate. It means that if they go into cardiac arrest, they don't want to be resuscitated. They want to just be left alone and let to die. And in part because, and there's many different reasons, but one of them is, the whole procedure of resuscitating someone is somewhat of a violent procedure, right? You could break someone's ribs. There are certain dangers involved in it. And, old people are much more frail. Their bones are weaker. They may not want to suffer that. But also some people have just decided at a certain point in their life that they've lived a long life and they don't want any dramatic measures used to prolong their life. Okay, that's a choice you have as an autonomous being. Not too many young people have a DNR because for most of us, if we were resuscitated, we would go on and be just fine, you know. Anyway, so be thinking about that, advanced directives, and make sure that you look at the case studies at the end of the text. There are questions at the end of those case studies that I want you to think about. You don't have to answer them. You don't have to write them out and send me the answers. But the questions will help you really get into and analyze the case study. And all these case studies at the end of the chapter relate to the content of the chapter. So these are going to be about paternalism and autonomy and medical futility and all those things. So make sure you understand those terms. If you have any questions, please let me know. I hope you're enjoying the class. I wish we could be in person, but here we are. So that's all for now. Like I said, contact me if you have any questions. My phone number is 913-909-6591. That's my cell. It's on the course syllabus. And my email address is Tamilio, just the letter J and then my last name, Tamilio, @salemstate.edu. That's on the syllabus as well. I hope you're safe and I hope you're healthy, not just because this is medical ethics, but because we're in the midst of this global pandemic. So wear your mask and practice safe distances, social distancing. That's all for now. Take care and talk to you soon. Bye-bye.